Good morning. We are sitting here in San Salvador, El Salvador, celebrating the 25th anniversary of Leaders in International Health. My name is Dr. Calae Dorsett, and I'm a participant from the Bahamas. This is the first time that the Bahamas has been participating in the Leaders in International Health program, and it's been quite a historical experience for me in learning all of the modules in international health. I feel like I've grown. It's been a life-changing time of learning about health diplomacy and negotiation, about how nutrition is a component in really all aspects of international health. In particular, trade, illegal and illegal trade is quite significant. The development in terms of the development model, and human rights. We have been really studying the Leaders in International Health framework to, to understand how we can, the goal of health equity of all can be achieved in Latin America and the Caribbean. Human rights. I think in theory we understand human rights, but in practice we still have a ways to go in even amongst ourselves as leaders in international health, practicing human rights as we communicate with each other, as we communicate with the public, as we respect that the public has an opinion, and we talk about social capital and social participation in the essential public health functions, but we have to respect the right of the child, of the woman, of the male in our societies so that they have a voice to speak to assist us in getting health equity for all. I think development is really significant as well. We need to understand more about development and the challenge with development as we look at the various countries that have different political models. And depending on the political model, it depends on the type of development. And compared to a foreign direct investment model, where the foreign investor is favored over the national investor. You talk about youth development. In most countries that is known to be important, but we haven't focused on that. So I think development, I think human rights, and I think trade too. As we trade, we have to remember these other areas of human rights and development, because trade is international. It will continue. It's just never going to end. But there's a financial component that we have to consider. We have to consider how trade impacts our communities, how it impacts internationally. So when we talk about trade in alcohol and drugs and tobacco, those impact on your human rights and your development. So I think those are three areas that we really need to look at, and how these also impact emergent diseases, which diseases that we once thought we had conquered, yet rises again in the 21st century.